Zoom recording. Yep.
Well, hello, I am Nick Medlock. I'm a trainer at Northwest Personal Training, and I'm here today with Dr. Corey. Dr. Trent Corey. I always mix up your name because I see
All
it
good.
backwards. Uh, Dr. Trent Corey is a physical therapist and a good friend of mine. We love to jibber jabber about anatomy and health and all the things under the sun for helping people feel better. And today I really want to talk about two things: an upcoming talk that he's going to have at Northwest Personal Training about ankle health and foot health and why that's so important, how it runs all the way up your anatomy chains, and also some new technology that he has at his practice called soft wave therapy. So Trent, I'll let you take over for that and get us going.
Yeah, awesome, Nick. Yeah, definitely the things we talk about with foot and ankle health, as we've talked and nerded out many times about how that's the base of your body, right? So, you're putting your full body weight through each foot and each step, and that has to be a fundamental piece of how we move. And if something's off there, it's going to cause us an alteration of our structure and can cause anything up the chain to be a problem. So, we definitely want to make sure things are moving well and that we have the strength that we need and the mobility that we need to function well. And so that's a big thing that I try to make sure that all of my clients, at least I'm looking at how their feet are interacting with the earth, right? And how we're doing. And so and most of our world is kind of just flattened out with just flat carpet and wood and or whatever, not on the rocks and the trails as much. It's really important for us to connect to that as best we can, but making sure our feet are well adaptable. And that also we're pairing, if we're not barefoot, then, we've talked about barefoot, but, how do our shoes and how do all those things work together to make sure that we're optimizing our body's ability to activate muscle? Because if you're strong and based from the ground up, then you're able to generate the force that you need and be functional with whatever you're doing. So super important topic, definitely one of the basis of just movement in general. So yeah.
That's awesome. And this is one of my favorite topics because every time I do yoga, I start with the feet. Every time I talk with a new client, I talk about the types of shoes and how we get our feet kind of squished and some of the different things like muscle atrophy, bunions, and things like that. But I also say, like, if you've got a particular toe bone or metatarsal out of place, it can affect even your shoulder just based off of the way that you have to move your gait. And maybe even the way that you see can cause like muscular dysfunction, like in the scalenes, things like that.
Yeah.
Would you address that in the next upcoming talk also?
Yeah, definitely. I mean, the whole thing is like looking at function of all the pieces, and it's an integrated whole, right? So, in my room here, I have these pictures of, I could show you over here. Maybe you can see them way in the back there. Are these pictures that show these anatomy trained pictures from how they're all connected. Actually, I see one right here. Okay, so right here. So, like I'm looking around, you probably couldn't see it, but basically how everything crisscrosses in different things. And so I look at a whole integrated model. So like, let's say, yeah, something's going on in your right shoulder, could be related to your left hip, but also could be related to an ankle issue. So we're looking and screening whole body movements to make sure that things are roughly as balanced as we can get them. But yeah, it's amazing how a lot of problems can just stem from like an old injury from like I twisted my ankle and I couldn't walk on it for a week, back in high school or whatever. And you're like, wait, that's actually a significant, whatever, grade 2, could have been a grade 3 ankle ligament tear. And we just kind of shake that off and go, well, it's just what it is. You rest it. And then, but a lot of times that residual weakness can lead to, hey, I didn't push, for months, even after I felt like it was fine and it didn't hurt anymore, we still see that people will not push off as much on that one side. They're favoring it just to protect it, even if it doesn't hurt. And then we get less mobility in that area. And then we get this pelvis shift that happens. And then it happens all the way up the rib cage. And then, like you said, it could be anything up in here. Like that can be related. It's not, it's not too far of a stretch to have these things kind of line up to be a problem. And so the holistic model of looking at how everything moves together is not just doing it just for its own sake, but just to know that we're reaching more of a cause of the issue versus just going, well, you hurt here, so maybe we look a little bit in the T-spine, maybe look a little bit in your neck, and that's all we need to do. Or let's say we're a little more global looking at T-spine and lumbar spine. But it's like, no, I mean, you're a walking human being. As you're moving your arms, you're moving your legs, all those things work together. So you want to make sure that all those things are working together. So making sure we're balanced and that we're talking about that it's not just like, oh, my ankles are fine, right? We got the workshop here coming up, but you say, okay, well, even if I don't have pain there, if you have any sort of issues that seem to be chronically going on, have you really screened the things that we're going to screen in the workshop? Maybe we'll kind of do some basic tests in the workshop. A lot of people are just weak in critical areas, but also, hey, they just don't move through certain spots, or they just collapse in because they don't have ankle mobility, and then their foot just collapses in. And so then that leads to a knee problem because their knees buckling in, or but also maybe their hips are not strong enough, so that's why the foot's going. So we always kind of have to look at how, things feed forward or feed back to each other, and what things are the cause of other things or the effects of something else going on. So we always have to look at it from a holistic perspective, but it's just a good topic to be able to just discuss of how the whole body is linked to, starting from where your foot is interacting with the ground. So
Yeah. Well, that's awesome. Well, speaking of ancient injuries, I have an old one in my ankle, and it was in high school, just like what you were talking
yeah.
about, and my 40s and starting to deal with that. And it's a lot of the peroneal tendon got really damaged. The doctor said I should have, or I would have been better off if I broke my the actual bone because there was so much damage. But just like a kid, after the boot came off, I just treated it like anything else, and I didn't know how to rehab. I didn't even know have that idea in my mind, and I just went on about my day, doing my martial arts, doing my running, doing my weightlifting, and everything.
Yeah.
And now I'm spending a lot of time because it does work its way up the chain,
Yeah.
but as I was expressing to you when I met with you the other day for your new technology, that's a lot of that tissue is it feels like it needs to be worked and treated in special ways that not just regular exercise it would help a little bit, but it needed a little bit of an extra push, so to speak. So that's
Mhm.
where I want to bring in technology because I thought it was a fascinating new bit of gear. And I don't understand all the physics of it yet, but I am studying up on it. But maybe you'd like to elaborate on
Oh,
how
yeah.
that work.
Yes, absolutely, Nick. Yeah, thanks for pointing that out. It's been an amazing shift for me in my practice in the last month. I've just gotten it just around the Super Bowl right now. It's mid-March, so it's only been about a month since I've had the machine. I've had some really amazing shifts for people with foot and ankle pain, but also knee pain, back pain, etc. What's really great is that we can stimulate quite a bit of a healing process through the machine. So instead of just miming with my hands, I'll kind of show you over here. I'm in the clinic here. So we're on my Wi-Fi connection of my phone. So hopefully we won't die here. But so here's the machine itself. It's called the SoftWave TRT machine. And so what we want to look at is here we have our device that's got water inside of there. Okay. Inside of that water, inside of that membrane, there's a little spark plug inside the water. And what happens is and you might be able to see this, as I do a shock here to my hand here, you can kind of see it kind of makes a noise here. And so it's sending that sound wave really at high speed at about 3,300 miles per hour through the water and then through into our tissues. So if I'm working on an ankle or whatever I'm working on, getting on a tendon, I can actually put this in there and just kind of push it through there. Okay. And what happens is over uninjured tissue, it actually feels fine. Okay. Because there's no reverb or any sort of like inflammation process. That's kind of my understanding. Doesn't seem to bother over uninjured tissue. But if you get over some tissue that you've been having some issues, or if it has inflammation or some extra scarring or something, it will light up. It will definitely be a little uncomfortable, as you may know, Nick.
Yeah.
There's certain spots right? And so what we do is then we work over those spots and just kind of make sure that we're getting to them. We can turn this down. There's energy levels on here. You can kind of look at the machine here. We got these different levels. And so there's level 8. We can bring this up or down. We can go up or down. And I probably can't see that too well. But anyways, it's kind of nice to see that we can kind of adjust it up or down based on what your comfort level is, because there's certain spots that are pretty uncomfortable. That actually lets us kind of diagnostically know what spots need to be worked on. And so there's certain, like, you can kind of work your way up on the side of the leg and you're like, wow, that was a little more intense. Or, hey, around my cuboid, which is the outside part of the ankle, boy, that was feeling something intense. And as you know, like I could move around and then you could tell me, whoa, yep, right there, right there. And it sometimes makes a different popping noise, which
Yeah.
sometimes lets you know it's creating some sort of, breaking down of that scar tissue, or it's just kind of sending a different, when it's sending in that wave, it bounces back at a different kind of frequency sometimes. And so sometimes it makes this really interesting pop noise, really fascinating. And so, sometimes it seems coincidental, but other times when you hear that certain different pop noise, you're like, ooh, that was something. And then,
Oh,
but it's really kind of cool way to kind of know what areas we need to work on. And then we can also kind of take notes of that, like how many shocks we do. Typically, I might be between, usually around up to 1,000 shock waves during a treatment. Just depends on how many I feel like is needed. If it's a smaller area, maybe a little less. Maybe a bigger area like a low back might be like 1,500 or so. So I try to give people a good dose so we can actually get deeper to those tissues and you get those responses. But also it's neat as you go back to the tissue, you go to a spot that's really tender, you might move away from it for a little while and then come back to it. And with that same intensity that might have been pretty uncomfortable, many times it's feeling a lot better. And that's kind of showing like a nice immediate response, which is a nice pleasant effect of the treatment, that we're not trying to, a lot of times it will feel better right away, even though we are just stimulating a stem cell reaction that is basically it's stimulating your body's a chance to like feel like it's getting injured, but it's not actually getting injured. So that's kind of a nice way to put it. The body goes, oh, something's going on. I need to send things to this. So it's sending stem cells to that area to help heal that area. And then that proliferation of stem cells can happen up to 8 to 12 weeks after that treatment. So even after 8 to 12 weeks of the treatment, you can still get these benefits. And that happens that people will get the treatment. They might feel better right away, but I don't hang my hat on that or expect it. I've usually people like generally people do feel better, but then after the second visit, after the third visit, people are really noticing shifts. And that's when I've kind of gathered a lot more testimonials saying, holy cow, wow, this thing is doing something on a whole different level. And it's just at a different depth that you can't really, I mean, it's hard to describe. I'm sure you maybe could describe, but it just goes so deep in ways that I cannot do with like a gua sha tool or
right.
just my manual therapy techniques. So I've been really in love with this thing. It's been really great. I've been having just my clinics getting busier and busier because people are hearing about it and really loving the results. So yeah, it's definitely a great thing. So
Well, I can say just as a person who I've experienced one treatment with you on it, it immediately did hurt, and the difference in sound definitely was corresponding to where the pain points were. So there's definitely a different sound for each click, and so that was super interesting. And then the pain threshold did increase my ability to withstand the pain. The more clicks happened, and then you kind of moved away. And even though it hurt in the moment, it felt so fantastic afterwards, even for days. And I could feel more mobility even in the tissues in my foot. And then my gait changed immediately because I wasn't in pain and my range of motion was different.
yeah,
So just immediate relief. But some of the things you were saying, I was going to ask about the stem cells, but you brought it up.
yeah.
So I'm in with a couple of different questions. Is it similar to stem cell therapy, or is there a difference in that? And then how is it reacting that way towards arthritis and osteopenia slash osteoporosis?
Yeah, so it's like, well, stem cell therapy is actually when well, either you take some stem cells from something like cord blood or something like that, or you harvest your own from your fat cells. That takes quite a bit of a process and laboratory. In most folks, it's around 5 or 7 grand. At least that's what I've heard as a quote for those types of treatment. It takes quite a bit of money to get that done, and it's just a localized spot, and it's invasive as well, right? You're injecting into an area. I've had lots of people, or I've noticed some people do have great results with that. And folks like Tony Robbins, he's wrote his book on it, how he tore his shoulder and he got stem cell. Well, that's Tony Robbins. He can spend whatever he wants on it. He probably can get quite a bit of results. So that doesn't seem to be as accessible as something like this, where you can come in. This only takes about 10 minutes to get the treatment done. You just come in, it's your shoulder, or your foot. Let's go with the foot. You just take your shoe and sock off. We get to the spot. We put the ultrasound gel on it, and we just put it on there and then just start delivering the shocks. So that's what's nice about it. It's the accessibility. The cost is much less. So it's in the range of a couple $100 versus a few thousand, thousands and thousands of dollars. The market's kind of gone up and down. Most people are around between $150 and $300 for a simple 10-minute treatment, which sounds like a lot, but when you kind of frame it in maybe the effects that it's able to do with something so accessible, and then the results I'm getting, it's meriting the price of that kind of thing. I think it's really kind of a cool way that we can get people to get the care that they need and get something similar to what maybe a stem cell injection would do. Not really sure, maybe it would be better to get the injections, but also, hey, how much more do you have to spend? And sometimes we have to kind of weigh our decisions with our health choices and kind of figure out what's going to be best. And then you asked about arthritis, inflammation, or osteoporosis, osteopenia, that kind of thing. So what we're doing is we're sending in a signal to the body to do some sort of building. And so we want to make sure that as we do that, we're also we're appropriately stressing and straining the tissues in a way that's therapeutic. So like, you wouldn't want to just completely rest that area. You want to give it relative rest, but you want to do movement to stimulate the conditions for those tissues to move and get better. And so, that's the idea. People with arthritis can do amazingly well because a lot of times pain can be from structures around that knee, the myofascial structures and tendons and ligaments, etc., to around that area. I've had really good luck with some people who've had kind of this patellar tendonitis stuff, but also medial meniscus issues, those kind of things, any sort of problem like that. And they may, with that, have degenerative changes that naturally occur as we age. They could have mild arthritis and still get quite a bit of improvement. With people who are more severe, who are like near bone on bone, and they're more towards like surgery, they're looking down the line going, I'm probably going to eventually get this replaced. I tell people it's totally worth it to just give this non-invasive treatment a try to try to loosen up areas around that spot. I've had many people get off the table from a knee treatment and go, wow, it just feels like it's loose. Like it just feels looser, it just feels better. And so sometimes it just kind of challenges our notion of what is going on inside of joint, being like, oh, it's bone on bone, therefore I'm going to be hurting forever. That may not be the case. I'm not saying that you still may not need a surgery down the line, but also it's like, if we can do some sort of treatments like this to avoid that problem, or to kind of push that surgery down the line, that's probably more appropriate for people, especially as they're aging and want to stay active into their 70s, 80s. If you get your replacement in your 50s, that's a long time for that replacement. And then revisions, anytime when you have a knee replacement surgery, the joint itself, the actual pieces do wear out. They're getting better than they've ever have. And hopefully that's not as much of a problem going forth, but that does become an issue. So we want to make sure that, you're at an age that if you can table it off even just a couple of years, that's great. obviously you want to make sure you're healthy, you're feeling good enough. Like if you're still kind of hurting, that's when it's kind of an inevitable thing sometimes with that. But this kind of changes my mind about sometimes these non-invasive ways that we can help people feel better. So that's kind of what I'm trying to lean people towards. Always have that surgery and the back option. The last thing you need to be doing, do all the other things first.
Yeah. Well, that's awesome. Well, that sounds like it's right in both of our wheelhouses, because neither one of us are surgeons, but we also
Yeah.
encourage people to move. And this therapy sounds like it's great to get you out of pain, but also help you heal, but also encourage that movement that we need for healthy mobility, and to keep us moving in ways that don't aggravate or encourage the bad postures that we have because we're in pain.
Yes, right. Yeah, we have these compensations that happen. So once we start feeling better and we're encouraging healing, then you can get people back into the gym, right? You have someone who's hurting, we go to the gym. Hey, I can't move. But then once we start feeling better, we want to encourage that movement right away. Hey, maybe show some things in therapy, but also, hey, you got your gym routine, your body. You mentioned a few things when you said after your treatment, it's great to have people like you who are so self-aware. They know what they need to be doing. So, and we don't want to assume those things either, but if we have a good conversation, and that's what I've worked with clients that I have, I want a good working relationship and understanding, like, what I know about them and what they need to hear from me. And we're able to kind of talk out like when it may be appropriate to start running, or you can bump it up now, those kind of things, and making sure that we're progressing things safely. And that's what I think what's great about what you guys do. You're watching how people are moving, making sure that we're not compensating in ways that aren't going to be healthy for us. So it's all a good picture of it all.
Well, that's awesome. I'm going to have to start wrapping this up now, but I want to definitely encourage everybody to come and check out Trent's new device. Ask him all kinds of questions. If you have any comments or questions, you can leave them, of course, on social media for us, or you can reach out. But also encourage everybody to keep moving. We've got here at Northwest Personal Training a spring challenge coming up that's about finding healthy habits and sticking to them. A lot of that is movement based. And then also definitely at the end of March, Trent is going to be having this talk about ankle health and foot health and mobility. But also he has a regular practice called She Running. So definitely, if you're interested in that, leave some comments. We'll have all the information there. But yeah, definitely get involved in all the things that we have going on group wise here at Northwest Personal Training, and running wise for what Trent does as a regular practice and also as a physical therapist. So I'll leave it at that. Trent, thank you so much for talking with me today. It's been awesome.
All right. Sounds good, Nick. All right. Till next time. Awesome. Good job.
See you.
Thanks. All right. Take care.